Hi, this is Dr. Kurt Wohler for Autism Recovery System. We're going to talk about the urinary peptide test. So Great Plains Laboratory has this urinary peptide test, and what this looks at are these protein fragments, or small protein fragments that are found in wheat as well as dairy, specifically casein and gliadin. The casein is called casomorphine, the gliadin is called gliodorphin. These things have an opiate-like effect on the body, and what that means is they can have a chemical or a drug-like effect. And the test is broken down into whether it shows up high or not. And so the peptides can either be high for casein or gluten or both. In this particular profile, we see that the casein level is high, but the wheat peptide is normal. So this indicates that this particular child has a casein peptide sensitivity. It's not uncommon to actually find both markers elevated. In this particular profile, we notice that the casein marker is very high. In fact, the test maxes out at over 500 nanograms per ml. So anything above it, it just listed as 500. So very, very high. But we also have an elevation of the wheat peptide too. What I've noticed in my practice is that more kids, about 65, 70% of the kids tend to be more dairy reactive than gluten reactive. But that doesn't mean, of course, that that's always the case. It just seems that dairy is more pronounced as far as causing true sensitivities to these types of foods. And what we're talking about peptide reactivity, peptide sensitivity, is because these peptides have a chemical-like structure to them that is similar to opiate. They can have an opiate effect in the central nervous system. So they cross through the intestinal lining, they get into the bloodstream, and they can actually get across the blood-brain barrier. And once they're in the brain and nervous system, they start to interact with different opioid receptors. And so they have a stimulatory effect on opioid receptors. Now, that could blunt the pain response. So many kids tend to have an abnormal pain response where they don't react to pain appropriately. We know that opiates can cause constipation, so these things can lead to constipation problems, and it can lead to sensory imbalances. So it's known to, they've been known to affect language and eye contact and awareness. And some kids are so sensitive to these peptides, it's almost like they're addicted. And when the food is removed, many times there's a really strong negative reaction to this withdrawal effect. It almost appears like they need the food in order to calm down. And that just really goes to the heart of the fact that their brain and nervous system is really, in no better terms, I guess, addicted to these particular peptides. When you look at a food IgG test and compare it to the urinary peptide test, in some cases, the food IgG test might be normal, but the peptide is high. So in this particular case, this is just a test of a child out of China. We can see that the dairy reaction, this is casein right here, is minimal. So they don't have an IgG reaction occurring to dairy, so there's not an immune reaction, but there's clearly a peptide drug-like reaction. Typically, IgG reactions tend to cause more digestive problems, bloating, gas, loose stools, constipation sometimes, although there is research to show that IgG reactions can also generate inflammation in the body. But those reactions tend to be more delayed in their effect. Okay, so it's not always an immediate reaction where those symptoms occur. The peptide reactions generally are pretty immediate, and they're really more in the category of eye contact and language problems and sensory imbalances, sometimes triggering self-stimulatory behavior, this drug-like effect, which I just mentioned. So you can't be, both tests are really best to run, the food IgG as well as the urinary peptide test. At other times, the test will line up pretty strongly. Notice in this particular case, we've done a dried blood spot, shows very high IgG reactions to dairy, And of course, the casein morphine is also high. So we not only have a very high level of peptide, that drug-like effect, but we also have a high IgG causing immune stimulation and inflammation. But notice that the gluten or the gliadin markers for wheat are totally normal on the IgG, but they're high in the peptide. So we don't have a gluten sensitivity from an immune system standpoint, but we've got a peptide reaction. The bottom line is this particular child really needs to be off of both gluten and casein to get the overall beneficial effect. So ideally, if you're looking to do testing, it's best to try to do both the peptide as well as the food IgG. Now, you can also use a peptide test to check the diet, meaning that if you get a negative test and your child is not eating gluten or casein, then you can pretty rest assured that they're not getting any kind of infractions in their diet. So the food IgG panel ideally is going to be an indication of past exposure. So if your child hasn't eaten gluten or casein in quite some time, there still might not be an elevated marker. If you're trying to check whether it's okay for them to go back on the food, for example, well, unfortunately, if you do the test when they're off the diet, the results may turn out to be negative. Just because the test is negative when they haven't eaten the food doesn't automatically mean that that food is okay for them. So a lot of times you have to go back and look at what was their overall child's response when they originally went off of gluten and casein. What were the positive things that you saw, whether it was 3 months ago or 3 years ago? So the tests help to guide the identification of problems, but they don't always define a problem if the food is not being consumed. Of course, I'm always available for ongoing questions as well through the autismrecoverysystem.com website to get into this topic a little bit more in depth. Called labtestplus.com. This is where we carry the urinary peptide as well as the food IgG, and there's another video, by the way, on the food IgG test too. So you can go to labtestplus.com, look at the list of tests available, and each test, when it's ordered through the site, comes with an individualized written interpretation along with action step suggestions based on the information that that test provides. I'm Dr. Kurt Wohler for autismrecoverysystem.com. Thank you very much.